Hello, I'm Austin Heyman. Welcome to Seniors Today, a monthly program produced by the Commission on Aging and devoted entirely to issues and interests of Montgomery County seniors. This month we learn about low vision library resources available through a Maryland State Library program. And we'll talk with someone who has had a distinguished career in the field of aging. But first, we will talk with Margit Meissner, a Holocaust survivor and a longtime volunteer with the United States Holocaust Memorial Museum. Well, welcome to Seniors Today, Margit. Wonderful that you could come here. We've known each other a long time. I can remember we first met when the PTA world, when you were the first chair, I think, of the Special Needs Committee.
Right, that is correct.
So that's about 45 years ago.
Yes.
And since then you also, you had a career with the school system for about 20 years,
Yes.
helping high school kids who had disabilities
To become employed. Yes, I'm very proud of that. I think that's the greatest achievement of my life.
Really? Wow.
That I helped create an organization called Transcend, which really makes sure that the graduating seniors don't sit in their living rooms, but are out in the world and are employed.
And then you also was a volunteer with an organization you created, Voices Against Violence.
I helped create, yes, because I felt that there was too much violence in the world, too much violence in the school system, and that one had to combat that.
But for the last, I guess it's 14 years you've been a volunteer with the Holocaust?
Yes.
But you have a story that you tell there, I know, and you've written this wonderful book, Margit's Story, that tells the story. Give us a little insight. I know that you were in Paris and you were about 18?
Yeah, well, so very quickly, I was born in Austria but raised in Czechoslovakia. And when Hitler invaded Austria in 1938, I was 16 and I was in Prague, but excuse me, my mother didn't think I was safe in Prague. So she decided I should go to Paris, and she found me a family that took me in. And I was going to become a dressmaker, because if we lost all our assets, I had to make a living somehow. And I went to dressmaking school in Paris. And when the war started in 1939, my mother had come to Paris to be with me, but we became enemy aliens because we were part of Germany, and Germany was at war with France. And eventually my mother got deported by the French to a French concentration camp near the Spanish border. And I was in Paris by myself, and with the little money I had, I bought myself a bicycle and left Paris on a bicycle the day before the Germans entered. And by miracle, I found my mother, and by more miracle, we escaped to the south of France. But the French would not let us leave, although we had a Spanish visa. They would not let us leave. So eventually we walked across the Pyrenees from France to Spain and got caught by the Spanish police and put in a Spanish jail. But again, with miraculous friends, we were able to leave, and we then were in Portugal for 6 months, where we again miraculously got an American immigration visa, and almost to the day of 3 years since I left Prague, we came to the United States.
And how do you think that experience affected your life?
Well, it changed my life completely. First of all, I was a very well-behaved, very socialized young lady, and I became a citizen who started thinking about how the world was put together, and the kind of original sort of thoughts I have had about who I was. I became very much more open and really believing that I had a responsibility in the world.
So you meet with lots of different groups at the Holocaust Museum. I know you meet with children's groups. What are the lessons of the Holocaust that you want future generations to know?
Well, first of all, I want people to be aware of what goes on in the world so that they can participate. And if they see any kind of prejudice or anti-Semitism or bullying in their own communities, they can't just say, it's none of my business and walk away. They have to commit themselves to helping situations like this and to make sure that they help conflict situations be resolved in non-violent ways. So that's one thing. The other thing I want to tell people is that they should take risks in their lives. I think it's important to take a risk, and even if you fail, it doesn't matter, because you can pick yourself up and you've learned something. And I think it's much better to try and fail than never to try again. And then I am a perpetual learner, so I keep learning something new every time I go someplace, and I think that's a very good way of being. So I am very curious, and I think young people should be curious, so that's the only way they're going to find out more about the world. So these are the things that I try to leave with the students whom I interact with.
Now, it's not a secret that you're 96 years old.
No, it is not a secret.
So what is the secret to your longevity?
I'm curious. I keep learning. I exercise quite a bit and regularly, sometimes not gladly, but I keep on doing it. I try to eat reasonably, and I have lots of love in my life, and that is very important.
You have a lot of friends, I know that. You also gave a recent talk to medical students, and I think you talked about the invisible issues of aging. What is it?
Yes, well, you see, people think, well, she's 96 and look how well she walks. Mm-hmm. Well, I walk pretty well, but I have all kinds of handicaps for being that are associated with old age. First of all, I'm very deaf, so I can't, in lectures, for example, I can't hear what people are saying if they don't speak directly in front of me. I have trouble with reading, reading signs. I read much more slowly because my visual perception in my brain doesn't work well, so I see something and before I understand what it says, it's gone.
But in spite of all that, you really have, I think, are amazing. I want to read to you what you wrote in this book 15 years ago when you wrote your story. You said, "I believe that I have lived as fully as one can, and if I have regrets, they are overshadowed by successes."
Well, I think I would, that if I can't remember that I wrote that 15 years ago, because I have never been able to read this book after it was published. I think I really should read it. I read a little piece of it, and I thought it was really quite good.
It is. It's a great book, and you can get it on Amazon still.
Well, it sells very well at the Holocaust Museum. But I think one has to try things, and if you are successful, then it really adds to the reservoir of good feelings.
Thank you so much for coming and sharing your story with all of us. You've been a wonderful role model for all of us. Thank you so much, Margit.
Thank you for having me.
When we return, we'll have a conversation with someone who has spent a lifetime working to improve the lives of older adults. So please stay with us. We'll be right back.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
Welcome back to Seniors Today. I'm Austin Heyman. My guest today is Bill Benson, an expert on the issues of aging. Well, welcome to Seniors Today, Bill. I mean, I need to tell our audience that you've had a 4-decade career in aging. You were acting assistant secretary of aging. You were a consultant to the CDC on aging. And you were a founding member of the Elder Justice Coalition, and you served with the U.S. Congress. What more?
All right.
It's a very distinguished career, so thank you for being with us. So all this work that you've done for 4 decades, what one or two things stand out as major accomplishments?
During those 4 decades, well, in terms of the aging of our population and responding to it from a policy perspective, ironically, I think all the great accomplishments occurred before I even got into this business, if you will. Social Security, Medicare, Medicaid, the Older Americans Act, those were already in place. Since that time, I'm not sure that we have made major new accomplishments in that time. We've held on to those programs, we've improved them in some ways, but I think we've stalled out in terms of making great progress in terms of aging policy. And after 40-some years of doing this work, I'm a little frustrated, to be honest, that we've not made more progress with respect to such things as long-term care, mental health, oral health, vision health, elder abuse, housing for older people. I mean, there are so many great challenges we have.
So the issues are getting ahead of the solutions in some ways, is what you're suggesting.
The solutions that we've put in place, we've built this terrific, I think, foundation of public policy for older people. It's like building a house. We've built a great foundation, but we've not built the rest of the building, if you will. And because it has the need and demand, the scope of the demographics of an aging society have outstripped it from a resource perspective, outstripped it from a capacity to respond perspective, and probably from a political will perspective as well.
So if you were to go to Congress today, I guess what you're saying is so much of these issues of aging are federally related, because the things that you've cited are federal. Of course, that's where your experience has been.
Right.
And of course, states and localities and local communities have an important role too.
They sure do. They absolutely do. I think the big ticket items like income security, like health coverage, really can't be addressed at the state and local level because of the cost and the enormity of them, and the need to share the cost, as in social insurance, across a very large pool. So those are why, to a large extent, those are federal programs. But at the state and local level, I think the response there are to fill in the gaps that exist in the big federal systems. We can't look to states and local communities to finance all the housing that older people might need, but we can look for favorable economic conditions. We can look for favorable tax conditions to help stimulate some growth to fill in those gaps, to also innovate and do innovative and new ideas. Testing ground at the local levels where it happens. But those things percolate up, we hope, when they're good enough to maybe become something we can do on a grand scale at a national level.
So specifically, I know in the county, the affordable housing is a major issue.
As it is everywhere.
And there have been discussions about what can we do locally. There are some things, as you suggest, we can do locally, but the big ticket item, the money has to come from the federal government.
I believe it does. So much of the housing that we have for low-income older people. Now, you can, at the state and local level, you can address the housing needs of people who can afford it. Builders can respond to that. You can do the right tax breaks and all of that. But for low-income people, that's a tough nut to crack locally or even at the state level. Unfortunately, the principal program for financing low-income housing for older people and people with disabilities was a Section 202 program for years. All new construction has terminated. There is no financing for any new construction in 202, just as the numbers of older people are literally exploding as we're doubling the older population in this country. All we're able to do at the national level, or all we are willing to do at the national level at the moment, is to maintain the financing for the existing projects in place because they have long-term mortgages and the payments.
So, obviously, health care is a major issue for older people. It's for everybody, but
right.
And you've mentioned Medicare and Medicaid. I just saw a piece about Alzheimer's that, of course, we know that the numbers are growing, and when we get to the point where we have some kind of a solution or something, it's going to be so costly. The caregiving part of Alzheimer's is so costly. How again, is that going to have to be a federal solution?
I think that's one where you can have local solutions. You can have state solutions. Supporting caregivers, doing more for caregivers at the community and state level. A lot of innovation around caregiver support. But if we're talking about providing a workforce to support that, then we're going to need to look to things on a more national scale, I think. If we're looking for the payment for caring for all those people with Alzheimer's and other dementias, Alzheimer's is now the 5th leading cause of death among the older population. It is that large, and the numbers are only going to grow because the demographics are growing. So we need to tackle those as national problems. It's not a solution to say to an innovative, progressive state like Maryland, you take care of it. Maybe Maryland can do some really good things. I mean, Montgomery County is a tremendous place to grow older. I mean, many communities would, if they knew all that's going on in Montgomery County, they would envy this place. They might also want to move here. But that's not what's happening in all counties in Maryland, much less the rest of the country.
Yeah, well, we have been working hard on many of these issues within the ability to deal with them. But as you suggest, the cost factor of this is formidable. I mean, I kind of had the thought that everybody ought to have long-term care insurance. We ought to start when we're 21 paying. I mean, I don't know what you think about this, but we ought to start paying for, like we pay for Social Security, we ought to start paying for long-term care insurance when we're 21. But maybe that's too radical of it.
It wouldn't be if we decided that we wanted to expand Medicare as a social insurance model, build in, so the cost is spread across the entire population, employers and employees and everybody else, so that you could begin building in the long-term care services as part of our Medicare structure. That would make sense and start early, because these costs are so huge when you get to the point where you need them, as you know. But if we don't do it as a social insurance model, there's no way that I think private long-term care insurance is going to be the answer for everybody. It will be for a select few. I have private long-term care insurance, and I'm really grateful I have it.
Yes. You are a consultant, I know, for many people. Do you have a website?
I do. healthbenefitsabcs.com.
Okay. Well, before we leave the subject of aging, there are many things that have happened that are positive that we've learned on how to age well. Isn't that true?
Absolutely, absolutely. The amount of evidence that we have accumulated about various kinds of interventions dealing with everything from falls to healthy diet to combating malnutrition to dealing with chronic disease self-management. We have a whole arsenal, if you will, of evidence-based ways to deal with people's health and wellness. There's no question about that. Now we need to get those out into the mainstream more effectively. We need to put them in communities across America. If we're going to get ahead of the alarming curves about the chronic disease issues that older people have. But yes, there are many success stories. The challenge with our demographics in this society is taking things that we know work, all those positive things, and taking them to scale.
And I think we are working on many of these things in the county. Falls prevention, engagement as a way of being healthy. Those are the kinds of things that we can do locally.
Absolutely.
To make life better as we age.
Absolutely. All the things you're doing in Montgomery County, from lifelong learning to wonderful coalitions. You're doing tremendous things here, and those are things communities can do, and they're really important. The issue of isolation of older people and trying to engage them and recognize them for the asset that they are to a community, that's not going to come from the federal level. It's going to come from the community level, and I think you're really doing an honest job of it here.
But I think your point about the federal situation, that leads to we need to be engaged. I guess you're suggesting politically.
I do suggest that, in fact, I would state that very explicitly, that we are not responding to the needs of an aging society if we're not engaged politically, because ultimately the responses to the major problems and challenges are political solutions. That is, the politicians and the policymakers have to have the will, and in order to have that will, they have to feel the heat, so to speak. And I think that aging advocates need to become political advocates as well. All of us need to do that if we want to address these issues.
Well, thank you so much for coming in and sharing your views with us.
Thank you, Austin.
When we return, we will learn about low vision library resources, so please stay with us. We'll be right back.
Did you know mosquitoes can be carriers of Zika virus? The virus is especially dangerous to pregnant women. You can catch the Zika virus by being bitten by certain types of mosquitoes, Aedes aegypti and Aedes albopictus, or by having unprotected sex with someone already infected. The most common mosquito in our region is the Culex mosquito, which is not currently known to carry Zika. Get rid of mosquito breeding spots by reducing sources of standing water, like empty buckets, bottle caps, trash can lids, tires, etc. Wear long sleeves and pants and use mosquito repellent. Avoid travel in Zika-prone areas, especially during pregnancy. For more information, visit montgomerycountymd.gov/mosquito or call 311.
Welcome back to Seniors Today. The mission of the Maryland State Library for the Blind and Physically Handicapped is to provide comprehensive library services to the eligible residents of the state of Maryland. Here to tell us about the many resources available is Ashley Biggs. Well, welcome to Seniors Today.
Thank you.
So tell us a little bit about the role of the library for the blind.
Well, the role for the Library for the Blind and Physically Handicapped is primarily to provide accessible reading materials to those who are unable to read standard print. So this means if you have low vision, no vision, physical impairments, or organic impairments that prevent you from reading a book, we can provide you accessible formats, audio, braille, large print, and we do so at no cost. We also provide accessible technology training as well as cooperative services with public libraries across the state.
So you're located in Baltimore,
yes,
but you service the whole state.
We serve the entire state.
And I see you have this what I call gadget here, but I know a little bit about it. Tell us a little bit. That's a wonderful.
It is one of the best things I have ever seen in my life. This machine allows you to listen to audiobooks and magazines provided by the National Library of Congress, and it's completely portable. It weighs about 1.5 pounds to 2 pounds. It comes with a handy dandy remote, and it's simple to use. Has a battery life about 30 hours, 29 to 30 hours. After that, you plug it in and charge it.
And it's free.
Yes.
This is what so it's provided by the Library of Congress throughout the country.
Yes.
Now, how does one go about accessing this? If you
To sign up for our services, what you want to do is fill out an application, which you can find on our website, which is lbph.maryland.gov, or you can call the library directly at 410-230-2424. And we will send you out an application. You fill out the application. You have a certifying authority like a doctor or a medical professional, social worker, someone who you've worked with that can certify that you meet the criteria for the service, and that's it. We send you a player. The whole process takes about 2 weeks.
So if somebody goes into one of our libraries, they could ask the librarian about all of the services as well.
Yes, we work very closely with Montgomery County Public Libraries, and their librarians there can walk you through the process.
Now, I think your title was Outreach Coordinator, so that must mean you go about the state.
I do. I get to travel. I've met so many awesome people, and I've talked to so many different groups. It's fun.
And have you been in Montgomery County with the groups?
I have. I've been to a couple of low vision support groups at some senior care living centers. And I've been working with the Department of Aging to go to senior centers around the state.
I know I think you mentioned before we went on Brook Grove and Asbury. You were.
Yeah.
You've also mentioned that there's something called a technology user group. What is that?
So the Technology User Group is a wonderful free service that we provide. It's run by our Accessible Technologies librarian. He's the person you would contact to train on accessible technologies such as computers and phones. But every month between March and November, he provides a topic of discussion, and a group of 15 to 30 people get together and they talk about how that service affects them, what they would like to see, how to use that service. And one of his big missions is not just having it in Baltimore, but providing recorded sessions so you can go back and listen later on, and to visiting other locales across the state.
So he also may come to Montgomery County?
Yeah, absolutely.
So this is technology. We're talking about the iPhone or the computer? Or
iPhone, computers, Android devices. He recently did one on the updates to the Amazon Echo and how you can use it if you have low vision. This last month, they discussed Windows Narrator and how to use the new Windows Narrator that came out with Windows 10.
In fact, there was an article in the paper just recently about, you mentioned the Echo.
Yeah.
It's Alexa that's become very popular and helpful, and I can imagine for people with low vision.
Oh yeah, absolutely.
So what are the most common requests that you do get?
In terms of materials, we of course get the very popular request, would you send us books by Robin Carr, would you send us books by James Patterson, things like that. We also get requests for events and programs that are accessible to those who have low vision or physical impairments. We get requests from parents and grandparents of children who have low vision and no vision. And a lot of times it's people who are interested in our downloading service, where you download books, audiobooks, and magazines directly to your smart device.
So you're a terrific resource. You want to give that phone number again?
It's 410-230-2424.
Well, thanks so much for coming in.
It's fun.
Well, that's it for this month's Seniors Today. Don't forget that you can access a great deal of information about county services for seniors by going to the Montgomery County Senior website at montgomerycountymd.gov/seniors, or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching Seniors Today.